Hello everyone, my name is Anila Rao. I'm a PGY6 from McLaren Macomb Oakland Hospital, and I will be presenting my clinical research on daytime versus after hours cardiac device implantation, similar complication rates with lower duration of stay. I have no financial disclosures. Healthcare is delivered 24 hours a day, 7 days a week, and never stops. Factors such as patient characteristics, urgency of surgery, and effects on providers based on time of day may all have an effect on patient care over the course of a day. After-hour surgery on particular procedures including CABG, thoracic organ transplant, as well as general neurological and gynecological surgeries have been previously found to have significantly increased postoperative mortality and morbidity, possibly related to the urgent need for intervention, limited resources, and staffing fatigue. Cardiac implantable electronic devices were not studied previously. The goal of our study was to observe if implantation of permanent pacemakers during daytime versus after hours led to increased complication rates. A secondary objective was to observe length of stay comparing daytime versus after hour cases. We performed a retrospective study in two community hospitals in the United States on patients requiring a cardiac implantable electronic device. The study period was between January 2021 to December 2021. The inclusion criteria for the study were patients who had an indication for pacemaker or defibrillator implantation. Patients were divided into two groups, daytime versus after-hour cases. Daytime cases were defined as any cases starting between 7 a.m. to 7 p.m. on Monday to Friday. After-hour cases included any cases starting between 5 p.m. to 7 a.m. on Monday to Friday, or any cases performed on Saturday or Sunday. 169 patients met the inclusion criteria. 136 patients had device implantation during daytime hours. 33 patients were found to qualify for after-hour cases. In the daytime cases, the average age was 76.1 years old, with 63.9% being male and 37.1% being female. The average BMI was 28.0. 24.2% of all the patients in the daytime cases were diabetic. Similar match numbers were seen in the after-hour cases, with 78.3 years old as being the average age, with 63.6% being male and 37.9% being female. The average BMI was 27.7, and 27.2% of the patients were diabetic in this group. Low perioperative complications were seen across both daytime and after-hour cases within a 30-day period of implantation. There was a total of 15 complications noted in the daytime hours cases, with 11 patients having ecchymoses around the pocket site and 3 having lead repositions needed. There was 1 death noted in the daytime hours cases. In the after-hour cases, there were 5 patients with ecchymoses noted around the pocket site, and 1 lead reposition was required after the case. There were 0 deaths noted in the after-hour cases. In both groups, there were no pneumothoraces, pocket hematoma requiring evacuation, and wound infections noted. There was no significant difference noted between the minor or major complications of daytime versus after-hour cases, with a p-value of 0.218. Furthermore, there was a notable downtrend towards in the time of admission to discharge and implantation to discharge observed in the cases performed after hours. Admission to discharge duration was 4.36 days versus 3.79 days in the daytime versus after-hour cases, respectively. There was a decrease of 1.69 inpatient days from implant to discharge in the daytime versus after-hour cases, respectively, as well. Our study suggests that pacemaker and defibrillator implantation during daytime and after hours is safe and had no significant difference in complication rates. We did note that there was a decreased length of stay noted in patients who had a device implanted after hours compared to implantation during daytime hours. However, further investigations must be made to evaluate implications of possible translation of this decreased duration of stay to healthcare dollar savings. Thank you for listening.